So yes, I'm looking at obviously student retention, which does build on from what Jenny said. So I've tried not to overlap with that. So what I start with is where we are currently. So I have to start with an oh dear, because our applications generally are down by 20%. Now I've been in education some time. I am only 29, as I tell everybody, but I don't think anybody believes me anymore. But from when I started, it was probably and it was used to be talked about at universities, at Senate, that midwifery was the most applied for programme. So I'm a bit squeaky. I've had this book for about nearly 6 weeks now, so if I start coughing, I apologise, and I'm hoping my voice holds out. But it was. So as the years have gone by, we did remain buoyant. Even in the COVID, obviously, was very buoyant. But latterly, because of the adverse maternity reports, which are coming out pretty much annually, which is obviously seeing the profession in the not-so-favourite light that we had before. And I personally think it's absolutely tragic. Attrition from midwifery programmes is currently cited at 13.8%. It varies year on year, and it varies from placements, because obviously if you have a small cohort, then you only need a couple to leave. That actually makes your percentage look higher than that. From the short programme students, those who are already adult nurses and coming to do midwifery, what the trend is that we're noticing as LMEs is, and certainly my own institution, is that students are saying, nursing isn't like this. I'm going to go back to nursing because we're nicer to each other in nursing. Now, that is not right. That is not right. So the reasons for attrition is placement experience, and I'm going to just dabble a little bit, but obviously not as much. Finance is a big one. It's an absolute biggie. And the question has to be, you're a key worker. You're training to be, you're educating yourself to be a key worker, yet it's going to cost you to do that. Now, if anybody can make any sense of that, I would like them to explain it to me, because I can't. A sense of belonging. We often have these discussions as to what is the difference from when I, for example, did mine all those years ago. And I think you can almost liken it to when we were employed by the trust, when we were salaried, we were part of the team. I'm not dissing supernumerary status, don't get me wrong, but we did have a sense of belonging, and we felt valued and respected, and we were trusted, and I felt very supported. But there is such a lot of disillusion with the profession, as I say, because of the reporting that's coming out. So often people say students are different. Are they? They still want to be a midwife. The commitment, the passion that they show when they come for interview is so evident. The work that they've done to get to where they want to be is evident. They are motivated. The application process is still competitive. But of course they are. I was a very different student to people 30 years before me. We all change, we all evolve, the world changes, so of course they're different. They've been educated differently. And the main difference is, though, they are now fee paying. We've definitely seen a demographic change. We are seeing, certainly for the 3-year programme, that we used to have, I would say, quite an even spread of ages, really, across the cohort. We are definitely seeing less people a little bit older or more experienced, because they don't want to take on the debt. They've got families. Why would they want to do that? They may really want to be a midwife. They'll probably make fantastic midwives, but they're not going to put themselves in financial difficulties. We have this thing about generation X, Y, Z, and so on. Yes, it's true. They're different, because it's a generational difference. It's not that they're personally different, the whole generation different. We need to move with the generations and sort of be how they are. I mean, my children are very different to me. I mean, I don't even know how to work the PlayStation. I pride myself on being very techie in some things, but give me the PlayStation, I'm lost. How do you do all the things? I just cannot get my head around it, so the kids have given up now. They are digitally competent, and they want a work-life balance, because they are struggling. So, as I say, the NHM long-term work plan is train, retain and reform. So they're looking at placement provision and the impact on students, and they want to look at the travelling time to placement, accommodation and the cost of it, and caring responsibilities that might have. That's in the plan. Improving learner experience is in the plan. Reducing attrition is in the plan. And expansion of degree apprenticeships is in the plan. That we would actually quite like some funding for that, please. Student retention, as I say, student midwives work, but the funding system really doesn't. Now, this is in England because Northern Ireland, Scotland and Wales have a different system. Doesn't mean to say they're any better off, but they are in a different system. So when there's done a survey from NHSE Workforce Training and Education, they found that 58.3% of student midwives considered leaving their course. That is disastrous. You know, our places are sort of like boundaried because we can only go on how many midwives are in the service and obviously the birth rate, and that's becoming even more important as we're going on. So this has put in, we all know about, well, you might not know, but the universities are in massive funding crisis at the moment. And, you know, and loss of students is a huge one. If we lose too many students, our programmes will not be viable and they will be culled. The universities have to make really, really strong decisions. There is the financial pressures on our students. The State of UK Midwifery Student Finance report from the RCM that was done last year details exactly the cost, and Jill talked about it this morning. What one KHE found, that students are actually putting 70 plus hours per week in because they're doing the programme and then they're taking on additional part-time work. Now, we've got to look at the working week and look at how fit they are for practice, because this is a concern. This is a real concern. The last we want is our, really tired student midwives, but they're working to stay on the programme. It's a bit of a catch-22 here. We're going to have to address this. And 8 out of 10 have taken on additional debt on top of their fees and their student loans. And that is unsustainable. If we're looking at expectations of placement, I think it's no different to when I started and anybody else. They're there to learn. They want to practice skills. They want to achieve proficiencies now. Over the years, be around long enough, we used to have proficiencies, then we had competencies, and now we've got proficiencies again. But anyway, whatever it is, it's things that the NMC tell us we have to achieve. And the proficiencies at the moment are massive. They're quite extensive, but it's looking at the future midwife and what we can best equip our midwife to be in the future, hence the future midwife standards. They want to feel valued and respected. Who doesn't? But more than anything, they want to become a midwife. So to lose students in the programme when their dream was to become a midwife is an absolute tragedy. Now, so for England, NHSC developed the Safe Learning Environment Charter. This started for midwifery only, but then, other professionals said, but we have learners in the same placement area. So then it became to be all-encompassing of learners in the placement area, which is absolutely right. Interprofessional learning is vital, but everybody is a learner, no matter what profession they're doing. So this was created in response to learners' feedback. NHSE colleagues came and spoke to all student midwives in every year group in nearly every university in England and asked them, what does good look like? And that was the question, not anything negative, what does good look like? And the students gave them what they thought was good. And so in response to that, that is how the Charter was aligned. So it's underpinned by principles of equality, diversity and inclusion, and it is to strengthen the NHS workforce. It's aligned to the NHS People Promise, and it's looking at the right skills and knowledge for safe and compassionate care. And these are the elements of the safe learning environment. Nothing earth-shattering, nothing that you wouldn't expect, but this is what students said good looked like if this is what they had. So I've just taken some comments over my travels and things when you're looking at what students say to you. And I'm going to look at an example of Trust A and Trust B. So Trust A, students didn't engage with me as a student. I was ignored frequently. They were quite rude and I was just ignored. I have overheard some midwives calling out students and laughing about them to others. That is really damaging to people, because you're thinking if they're talking about others, then they're talking about me. So instantly you feel on edge, instantly you feel that, you know, you're being watched all the time. And we all know that if you feel on edge, then you're more likely to say something daft or do a bit of a blunder. We're only human. Comments Trust B, the ward sisters and coordinators were amazing. They really valued students' learning. Doctors and anaesthetist support staff are all willing to teach. The passion shows, and how proud they are of the trust shows in their enthusiasm for showing students. There was respect, regardless of who they were. I did not feel at any point that anyone was more superior. It felt like a team approach to care. What a blissful... I mean, where students going to stay? Where they're going to work? I mean, you only need to look at where students want to go and where students stay, and look at staff turnover to actually identify where the problems actually are. Induction was a major thing with students, and many students sort of say that they were either inducted well or they felt they weren't inducted well. But two, again, contradictory statements. One was made to feel welcome, shown around, was made to feel part of the team. Small things matter, like having your name on the staff board, not the student. I felt like a fish out of water, but was reassured from the start and felt supported. Turned up on my first day. The housekeeper was lovely, showed me to where I could change, however staff ignored me. The whole experience was rude. Communication. I feel I got on well with staff in the unit, however comments have been made about having to have a student and blaming students for mistakes that have been made. Although a stressful environment, there is no excuse for how some staff speak to other members of staff, especially in front of patients, and it does make me question whether I'll continue employment with the Trust. Trust B, all the staff members I came across were friendly and supportive of me, encouraging me to do certain things to broaden my skills and helping me. Teaching and learning needs, used as free labour when other departments were short-staffed. No one has the time of day to train a student. The midwives themselves had said on several occasions that they feel too busy to be able to explain things fully, and therefore some information has been partially explained, some policies were not explained, so I was not always understanding of why observations were done so often, or why babies' BMs were being done, for example. I've been to this placement area multiple times, and every time I leave feeling underconfident, incompetent and upset. This has not been the case in any other placement area. Staff are not purposefully malicious, but they are empathetic to realise when they have upset someone. It has made me very stressed and anxious about returning to this placement area. There is a blame culture perpetuated among staff who discuss colleagues making mistakes in front of patients and gossip about these mistakes in the office. This is not conducive to learning and increases my anxiety about making errors. So, why the difference? Well, one maternity service. You know, why is there such stark differences? And this is where the questions have to ask. You know, two placement areas, same preparation prior to placement. Culture is an issue, but is it more than that? You know, what is it? You know, students have to travel, accommodation, childcare. This is what we need to look at. It's really difficult. Jill, someone who's talking today, I've got my mind's gone now, about the flexible working. That makes such a difference to students, as opposed to being, you know, ridiculed or she's not, you know, the student is not interested because can't get here before 7:30, misses the handover. She's a student midwife. She's supernumerary. You know, it's not what we'd always do, but if it's to do with childcare, the cost is phenomenal for childcare. We know that. And so if we want to keep our students, we need to protect them. So if we're looking at managing expectations, have any of you heard of the safe learning environment? See, not many. You know, and that's quite surprising. You know, this has been out for some time now. It is an initiative with practice. You know, it is practice responsibilities to look after their learners. That's what, you know, how it all works. So why is hardly anybody heard of it? Whenever I do visits with the MNVP when we do the 15 steps, so we do the LMS assurance visits. The first thing I look for is, where's the Safe Learning Environment Charter? You know, where's the linked lecture information? All of those sorts of things. So it's a bit of a slow burn, is this one. I think NHSEA would sort of a bit too. And it's a shame because it has all of the things that people need. Partnership working is absolutely critical. We have to work with our partners. Sometimes I'm noticing a little bit of where things aren't getting through, whereas before I was always the first point of contact. If there was an issue that involved a student midwife, I'm finding I'm getting contacted by HR now, not even the practice staff. Hang on a minute, you know, this is practice to university. Linked lecturers. We need our linked lecturers. The problem with linked lecturers in many universities is it's not in the workload model. And it's a really tricky one, is that one, because, you know, it's so important to have our linked lecturers there, to be involved in visiting the students, doing the updates with the programme, looking at SSHEA implementation and preparation, and all of those things, the walk around, you know, regularly looking at the the holistic assessment with our student midwives. So important that we retain this, but it's really hard to justify in many universities where they are at crunch point. It's important that students, midwives and the practice staff are familiar with the programme. I've had our short programme students feel really uncomfortable because they go in as a second year, and so they're being assumed that they're a second year. So when they say, actually, no, this is my first placement area, that midwife should know what that student programme is, what placement she's on, not make assumptions, but they felt really conscious. So, you know, we're looking at how we can address that, take off the stripes for the first trimester so that they get used to the students, so there's no assumption made. It's what can we do to help our students, and also understand the students' level in the programme. When I read the one this morning about the CTG, you know, if that's on the first placement, that is just awful, because that happens. You know, but a student doesn't know about CTG, doesn't know the consequence, might know what it is, but can't interpret it. The responsibility of that must be absolutely horrific for that student. The universities, I do talk about this extensively, you've heard me about the state of midwifery education, and I am really worried about midwifery education because universities do need support here. Lecturers in universities need support here with appropriate staffing. The appropriate skill mix. There's been many redundancies, VRS, across the piece with our universities. The experienced midwives have left. This is a concern. We have all these practice initiatives, and yet we're happy to have the most junior people come in as educators, which are brilliant, and they are brilliant, but they haven't got experience because the universities won't pay them the salary that they get paid in practice. So anybody who's over a band 6 or top of band 6 would take a 10 grand drop to come and be a lecturer in the university. Who would do that? You know, and it's such a shame. When I started, it was a significant salary increase. And obviously the workload model I've alluded to. Morale is quite low in universities at the moment as well because of the loss of the staff. And we need clear communication pathways between practice and universities. And I'm sad that I have to have this one on, but access to the placement areas. Some lecturers I know are having difficulty getting in to access because, you know, it's seen as practice and they will do their own education. We're a partnership. We're 50-50. Why are we discussing access? So, I'm on time? Fantastic. Anyway, so thank you very much. Yeah, any questions later, but thank you.